Hey guys, this is Maria from Iron Health. I'm one of the doctors of physical therapy here. Today we have Greg. We're just going to talk about some assessment and symptoms related to lateral epicondylitis, also known as tennis elbow. So a few things to keep in mind here is that usually lateral epicondylitis develops from a repetitive stress. So it could be gripping, it could be tennis, it could be something not related to tennis at all. It usually is related to point tenderness to the lateral epicondyle, and typically patients will say they have pain with wrist extension, maybe related to typing on the computer, gripping, grabbing a door, pulling it, turning a doorknob, opening a jar. All of these may be symptoms related to lateral epicondylitis. So we're just going to run Greg through a couple of tests today and kind of get an idea of what's going on. So first we're going to take a look at wrist extension. So I'm going to have Greg extend his arm. Good. Bring your hand up towards you. Good. And I'm going to try to push him down. He's going to resist me. Good. And in this particular scenario, if Greg said he reported pain at the lateral epicondyle here, it might be related to inflammation of the lateral epicondyle, the wrist extensor tendon bulk, which is related to lateral epicondylitis. So in this position, I'm taking a little closer look at what muscles or tendons might be irritating to Greg. So I'm going to feel around outside of the elbow here, and if he has tenderness right where the tendon is and it meets the epicondyle, that's indicative of lateral epicondylitis. And then if I put him into any positions where the muscle is on stretch and then shorten it, that will also give me an idea of what might be going on there. And then what I'm going to have him do is spread his fingers apart. Good. Lift only your middle finger up. Good. And I'm going to try to press it down and let me know if there's any pain there. If there's pain, typically that's also related to lateral epicondylitis, so that would be positive. With this information, this would lead me to think that Greg might have lateral epicondylitis, and a few things I would typically refer a patient to do is look at their ergonomic setup. I would usually show some stretches and exercises that Greg will demonstrate. Take a look at proximal muscle strength, so looking at biomechanics above the joint to see if there's any instability or tightness within the shoulder joint itself too that might be contributing to overuse at the elbow.